One of the common questions that we're asked as pediatricians is, why is there specific spacing in between vaccines? Well, this video is trying to explain what's going on in your body when we're giving those vaccines so it makes a little more sense. This is also especially important now that people are coming up with altered vaccine schedules, and this hopefully explains why that may not be the best idea for your child. In my practice, I commonly use a graph where I explain what's happening in our body. On the vertical side, this line represents the immunological response that our body has to the vaccine. On the horizontal line, this represents time, be it days, weeks, months, whatever. The dotted line represents where, when we're above that dotted line, we will keep us from getting disease. So, when we give this vaccine, you see this initial response where our immunity starts to go up. It'll go up above that little dotted line, and then eventually, with most vaccines, it starts to drop back down. Before it drops down below that line where we could get the disease, that's when we want to give the booster, so that we stay above that dotted line. This is especially important when we have people who are altering the vaccine schedule and trying to give it at a delayed time. If we alter that too much and spread that out, you can see that the two peaks are farther apart, and we have this period of time that's below that dotted line. In this period of time, we're capable of actually getting the disease, and that's what we're trying to prevent. Some vaccines actually have a much more robust response, and therefore the immunity or the time above the dotted line can last much longer, and therefore have fewer vaccines needed. This is very important as we're starting to see more and more of this anti-vaccine movement. And what I try and tell people is that everything has side effects: food, water, medicine, and vaccines. When giving something to your child, you want to make sure that you're getting the most bang for your buck, that you're getting the maximum impact for the side effects that you're going to acquire. Make sure that if we're giving vaccines that they're going to work. And trust me, the only ones that have been studied as far as the schedule are the recommended schedule. There's no way that any doctor, myself or anyone else, has the resources to do the studies where we're looking at antibodies or look at the sheer number and volume of patients that the CDC goes through when they're looking for the safety and the efficacy of a vaccine. Now, there's some variations that we can do with vaccines to make it safe, or if somebody has an immune problem, or even if you have personal problems with certain vaccines. But these altered schedules that we can use have been approved through the CDC. Make sure you're using a schedule that's going to actually work to prevent disease in your child.